area. He says he will vote for the stimulus, but expects more to be needed.
Congressman Bera, thank you for being with us. You're at home in the Sacramento area right now. If you could just give me a sense of how your home district is doing.
You know, we're starting to prepare for this. We've seen several deaths in my district. I had a chance to go visit my old hospital. I'm a physician by training, and get a sense of how they're preparing. And again, the order is for everyone to stay at home so we can slow this virus down and get prepared for, what potentially is coming our way here in California.
When you see what's happening at some hospitals like the one in Brooklyn, where, people are saying we can't keep up, where you see these pictures of nurses wearing trash bags, are we getting there? Are we going to get where we need to be?
No, the Trump administration was slow to respond to what we saw as a coming threat. We should have been preparing all the protective equipment, getting testing and supplies up and running and out to where they need them. I get the sense that the Trump administration is now trying to do that and manage the logistics, but we had 6 or 7 weeks to prepare, and we've been sounding the alarm. Again, I think they're doing it now. It may give those of us here in California the time to get ready and get prepared for this, but what I see in New York is devastating, and my heart goes out to those folks.
Dr. Bera, do you plan to vote for the stimulus bill, more than $2 trillion?
I will vote for the stimulus bill. It's not perfect. There's things that we would have liked to have seen in there. There are things that the Republicans wanted in there, but that's compromise. Let's not be Democrats and Republicans right now. Let's be Americans, and let's get this bill passed. And then we have to start working on the next bill, which will start to address what does this look like when we start reopening the country. And we have no idea when that is. That could be 2 weeks from now, 4 weeks from now, 6 weeks from now. But we've also got to start to think about how do we get the country back to work.
What would be in a phase 4? We saw the first one, with healthcare and testing. We saw the second one more on things like being able to take sick leave. Third one, it's a mishmash. What do you think should be in a phase 4? You mentioned that.
I think phase 4 will be a combination. $2 trillion is a lot, but talking to a lot of the economists, they feel like we actually have to go bigger than that if we want to shorten this recession. And we know we're going to be in a recession. We want to make sure it's not a depression. And if we want to make sure it's not deep. So I think there'll be additional stimulus dollars, but we also will start passing ideas of how do we start knowing when it's safe to get people back to work. You hear people talk about diagnostic tests. One thing we're going to start pushing, and we are pushing right now, is what's called serologic tests, making sure those are widely available. That's a test to see if you have antibodies to this virus. That would mean you may have been infected. You may never have known that you actually had the virus. And now you've recovered and you have some immunity. We don't know how long that immunity is, but it'll let us as scientists and doctors know when it's safe to start allowing people back to work. And we should let the science dictate when that is and when it's safe.
As we part, I wonder, Dr. Bera, if you have any messages or words for your brothers and sisters in scrubs still on the front line right now?
For the frontline healthcare workers, the nurses, the social workers, the doctors, thank you. You are all heroes to us right now. If this gets bad, I've still got an active medical license, and I think we're all going to be called into duty. And for those that are not in the healthcare profession, be kind to one another. Help out those neighbors who may be older or may have a chronic illness. And this is a time where the silver lining is we are coming together as a community and a country, and we're all in this together. So be kind, be well, and be safe.
Dr. Ami Bera, Congressman from the Sacramento area, we appreciate it. Thank you so much.
Thank you. Be well.
Congressman Bera told us he sees a quick approval by voice vote likely. That means all members of Congress, most in their home states, won't have to go back to Washington, as we've been discussing. How the DOJ is cracking down on scams, including some insight from Attorney General Bill Barr next.
There were a lot of schools waiting after Maria to be rebuilt, and nothing has been done.
Pues sí, todavía tengo